Parkinson's disease is a progressive condition whereby the signals communicated between the brain and nervous system are disrupted. This causes a number of impairments, many of which relate to movement. The symptoms are often subtle at first but become quite pronounced as the condition advances. What are the 6 early warning signs of the condition? Tremors. Tremors have been characterized as a key sign of the disease. Tremors involve a persistent twitching or shaking of the hands, legs or chin. The tremors may start gradually, sometimes starting with a barely noticeable tremor that may be in just one hand. Difficulty walking. A person's walking pattern may subtly start to change. A person may begin to walk a lot slower or drag their feet as they walk. This is often referred to as a shuffling gait. There may also be less of a swing in the arms when walking. Diabetes symptoms. What does your breath smell like? 2 warning signs of high blood sugar. Cramped or small handwriting. When a person starts to develop abnormally small or even cramped handwriting, it could be a sign of Parkinson's. The condition is known as micrographia, and doctors associate it with medical conditions that affect the nervous system or neurodegenerative disorders like Parkinson's disease. Loss of smell. When a person seems to have more trouble with smelling foods, or if the sense of smell has changed, it could be a sign of Parkinson's. Known as hyposmia, it occurs when someone loses their ability to smell. Loss of smell is one of the most noticeable symptoms of Parkinson's. Dementia. A specific type of pain can signal you're at risk. Insight. B12 deficiency. How you wake up in the morning is a sign. Tips. Heart attack. Best diet to reduce your risk. Advice. Freezing. This is when a person feels as if their feet are glued to the ground, especially when turning or changing direction. Freezing is also when a person feels like their lower half is stuck but the top half is able to move. Freezing also affects activities such as speaking or when doing a repetitive movement such as writing. Facial masking. Facial expressions involve subtle, complex muscle movements. If a person's facial expression becomes more serious, depressed or mad-looking, it could be a symptom of Parkinson's. Facial masking is related to bradykinesia. The facial muscles move more slowly or rigidly than usual, and people may also experience eyes blinking slower. Mayo Clinic said, Parkinson's disease is a progressive nervous system disorder that affects movement. Symptoms start gradually, sometimes starting with a barely noticeable tremor in just one hand. Tremors are common, but the disorder also commonly causes stiffness or slowing of movement. In the early stages of Parkinson's disease, your face may show little or no expression. Your arms may not swing when you walk. Your speech may become soft or slurred. Parkinson's disease symptoms worsen as your condition progresses over time.